Virtual reality. It sounds like something out of a science fiction novel, yet it's increasingly becoming a part of our everyday lives. From immersive video games to virtual tours of museums and historical sites, VR technology is rapidly evolving, captivating our senses and transforming the way we experience the world. The allure of VR is undeniable. It offers an escape from reality, transporting us to fantastical realms and allowing us to experience things we never thought possible. The technology is becoming more sophisticated and affordable, making it accessible to a wider audience. This rapid rise in popularity, however, raises important questions about the potential health risks associated with this captivating technology. While VR offers a plethora of exciting possibilities, it's crucial to acknowledge that this technology is still in its early stages of development. As with any new technology, there are potential downsides and risks that we need to understand and address. Just as we prioritize safety with any new tool or device, a cautious approach to VR is essential to ensure its benefits outweigh any potential harm. This essay delves into the health risks associated with virtual reality, exploring both the short-term and long-term effects on users of all ages. By understanding these risks and adopting safe practices, we can navigate the exciting world of VR responsibly and enjoy its many benefits without compromising our well-being. Stepping into a virtual world can be exhilarating, but it's important to be aware of the immediate physical effects it can have. Two common short-term side effects associated with VR use are motion sickness and eye strain. The immersive nature of VR, while impressive, can sometimes clash with our body's natural sensory processing, leading to discomfort. Motion sickness in VR, often dubbed cyber sickness, arises from a disconnect between what our eyes see and what our inner ear senses. In the virtual world, our eyes might perceive motion and movement, while our inner ear, responsible for balance, registers stillness. This sensory conflict can lead to nausea, dizziness, and even vomiting in some cases. Eye strain is another common complaint among VR users. Our eyes are incredible organs, but they can be strained when forced to focus on close-up screens for extended periods, especially the high-resolution displays found in VR headsets. This strain can manifest as eye fatigue, headaches, dry eyes, and blurred vision. While these short-term effects are generally temporary and subside once VR use is discontinued, they can significantly impact the enjoyment and comfort of the VR experience. Recognizing these potential issues is crucial, and we'll discuss ways to mitigate these risks later in the essay. While the immediate effects of VR use are generally transient, there's growing concern about the potential long-term health risks, particularly with prolonged and frequent exposure. These concerns center around vision and psychological effects. VR may exacerbate eye conditions or contribute to new ones. Especially in children, it could worsen nearsightedness. Blue light from VR screens is another concern, linked to eye strain, sleep issues, and macular degeneration. More research is needed, but caution is advised. Prolonged VR use may also impact mental health. It could lead to social isolation and disassociation. Blurring lines between reality and VR. Be mindful of VR's impact, especially on young minds. Children, with their boundless curiosity and eagerness to embrace new technologies, are arguably the most enthusiastic adopters of virtual reality. While VR holds immense educational and entertainment potential for youngsters, it's crucial to exercise extra caution when it comes to children's use of this technology. Children's eyes are particularly vulnerable to the potential negative effects of VR. Their visual systems are still developing, and excessive screen time, particularly in close proximity, as is the case with VR headsets, can interfere with this crucial developmental phase. This heightened risk underscores the importance of limiting children's VR exposure and enforcing strict usage guidelines. Beyond the physical risks, there are also concerns about the potential impact of VR on children's cognitive and social development. Spending excessive time immersed in virtual worlds could potentially hinder the development of essential social skills, such as reading nonverbal cues and understanding complex social dynamics, which are best learned through real-world interactions. Moreover, there's a risk that children, particularly those who are younger or more sensitive, may struggle to distinguish between reality and the virtual environments they encounter in VR. This blurring of lines could potentially lead to confusion, anxiety, and difficulty separating fantasy from reality. Section 5. Adult Concerns, VR's Impact on Grown-ups. While much of the discussion surrounding VR's health risks centers around children, it's crucial to recognize that adults are not immune to its potential downsides. Prolonged VR use can lead to various physical discomforts and even exacerbate existing health conditions in adults. One common complaint among adult VR users is physical strain and discomfort. Wearing VR headsets, especially for extended periods, can put strain on the neck, back, and shoulders. This discomfort can be particularly pronounced in individuals who already suffer from musculoskeletal issues, such as chronic neck pain or back problems. Another concern for adults is the potential for VR to worsen pre-existing eye conditions. Individuals who already wear glasses or contacts for nearsightedness, farsightedness, or astigmatism may find that their vision is further strained by VR use. The close proximity of the screens and the intense focus required can exacerbate existing eye problems and lead to increased discomfort. Furthermore, the immersive nature of VR can sometimes trigger anxiety or exacerbate existing anxiety disorders in adults. The feeling of being transported to a different environment, coupled with the loss of connection to the real world, can be overwhelming for some individuals, particularly those prone to anxiety or panic attacks. While the potential health risks of VR might seem abstract, it's important to ground these concerns in real-life examples. Unfortunately, there have been documented cases of individuals experiencing adverse effects from VR use, highlighting the importance of taking these risks seriously. In one instance, a young boy who was an avid VR gamer developed severe eye strain and headaches after prolonged use of his VR headset. His vision became blurry, and he experienced difficulty focusing on objects at a distance. After consulting an eye doctor, it was determined that his excessive VR use had contributed to the development of nearsightedness. Another case involved a woman who developed severe motion sickness and vertigo after using a VR headset for an extended period. She experienced nausea, vomiting, and dizziness that persisted for several hours after discontinuing VR use. This incident highlights the importance of recognizing the signs of cybersickness and taking breaks when needed. These real-life examples serve as stark reminders that VR, while entertaining and engaging, is not without its risks. It's crucial to prioritize safety and well-being when using VR technology and to be mindful of the potential consequences of excessive or improper use. Navigating the world of virtual reality can be exciting, but it's essential to prioritize safety and well-being. By following a few simple guidelines, users of all ages can enjoy the immersive experiences VR offers while minimizing the potential health risks. One of the most crucial tips is to limit VR exposure. Just as with any screen time, moderation is key. For children, experts recommend limiting VR use to short bursts of 15 to 20 minutes, followed by breaks to rest their eyes and move around. Adults should also avoid marathon VR sessions and take regular breaks to prevent eye strain, physical discomfort, and mental fatigue. Ensuring proper headset fit is another crucial safety measure. VR headsets should be adjusted to fit snugly but comfortably, avoiding any excessive pressure on the head or face. The headset should be positioned so that the lenses are directly in front of the eyes and the display is clear and in focus. Creating a safe play space is particularly important when using VR systems that allow for movement within a virtual environment. Clear the play area of any obstacles or tripping hazards to prevent falls or collisions. It's also advisable to have someone nearby to supervise, especially for children or those new to VR. The rise of virtual reality presents us with a fascinating paradox: the opportunity to experience worlds beyond our wildest imaginations, while also needing to be mindful of the potential impact on our health and well-being. The key lies in finding a balance, embracing the excitement of VR while using it responsibly. This balancing act involves educating ourselves about the potential risks, setting healthy boundaries, and listening to our bodies. If we experience any discomfort, whether it's eye strain, dizziness, or physical discomfort, it's crucial to stop using VR and give our bodies time to recover. Parents and caregivers play a vital role in guiding children's VR use. Open and honest conversations about the potential risks, combined with clear rules and limitations, can help children develop healthy VR habits from a young age. Encouraging breaks, alternative activities, and real-world interactions can prevent excessive VR use and promote a balanced lifestyle. Ultimately, the responsibility lies with each individual to use VR safely and responsibly. By being aware of the potential risks and taking proactive steps to mitigate them, we can harness the power of this transformative technology without compromising our health or well-being. Virtual reality is here to stay. It's no longer a futuristic fantasy, but a rapidly evolving technology that's becoming increasingly integrated into our lives. As with any technological advancement, it's essential to approach VR with a balanced perspective, embracing its potential while acknowledging and addressing its limitations. The potential benefits of VR are undeniable. It has the power to revolutionize education, entertainment, healthcare, and countless other industries. However, we must remain vigilant about the potential risks, especially as this technology continues to evolve and become more immersive. By prioritizing safety, promoting responsible use, and fostering open discussions about the potential impact of VR, we can harness the power of this transformative technology while safeguarding our health and well-being. The future of virtual reality is bright, but it's up to us to ensure that it's a future we can all experience safely and responsibly. As we continue to navigate the world of virtual reality, it's crucial to stay informed about the latest research and safety measures. Recent studies have shed light on both the potential health risks and effective strategies to minimize them. For instance, a 2023 study by Stanford University highlighted the importance of taking regular breaks during VR sessions to prevent eye strain and reduce the risk of motion sickness. Experts recommend the 20-20-20 rule. Every 20 minutes, take a 20-second break and look at something 20 feet away. Additionally, a report from the University of Tokyo emphasized the need for proper calibration of VR headsets to ensure a comfortable and safe experience. Ill-fitted or misaligned headsets can lead to neck strain and prolonged discomfort. Mental health professionals also caution against overuse, pointing to research that links excessive VR usage with increased feelings of isolation and anxiety. They advise users to balance their VR activities with real-world interactions and physical activities. Practical advice from experts includes setting time limits for VR sessions, using ergonomic accessories, and staying hydrated. These measures can significantly reduce the physical and mental strain associated with prolonged VR use. By staying updated with the latest research and implementing these safety measures, we can enjoy the immersive experiences VR offers while safeguarding our health and well-being. Remember, the key to a positive VR experience lies in informed and responsible usage.